Hi, my name is Kristen Connect, and I'm president of Head, Shoulders, Teeth, and Tongue, and we are oral facial myofunctional therapists. And today I'm going to go over the muscles of the tongue. So I got this picture from my book, Anatomy of the Voice. I also take voice lessons because once you get control of your tongue, you just want to sing about it. But anyway, so the tongue is the actual tongue itself doesn't have all that many muscles. It's got about six, a pair of each of these. We've got the superior longitudinal muscle, the vertical and transverse muscles, and the inferior longitudinal muscles. And those muscles move the tongue shape so that the tongue can be narrow or wide or curved or cupped, but just moving the shape. And then we have all the muscles that hold the tongue in space or hold the tongue such that it's staying in the mouth and so that it can protrude out of the mouth and it can retract and it can move up or move down or part of it can be up and while part of it is down and it can cup things and it can hold things and it can undulate to swallow. So we've got the styloglossus here and the genioglossus, which is a super important muscle. If that muscle is functionally lazy, we've got issues. We've got the myohyoid muscle, which connects from the tongue to the hyoid bone. And then we've got the palatoglossus muscle, which connects all the way up to the soft palate. So this is just a 2D picture, but if you can imagine, this is the 3D object that is our mouth and throat, right? So once we've got the palatoglossus muscle, the stylohyoid muscle, the stylopharyngeus muscle, and all of these muscles are working together. And if any one of them is not working very well, then the other muscles have to compensate for it. And they're not going to do as good of a job as the muscle that's supposed to do its job, right? So when I was talking about, I've talked in other videos about what we look for when we're doing an assessment. And when I have someone stick their tongue out, they need to be able to use their genioglossus muscle. That muscle moves the tongue out. And then the styloglossus muscle, this one, is going to retract the tongue. So those two work in a pair. And then we've got the hyoglossus and the palatoglossus, right here. And that one's going to help move the tongue side to side, as well as elevate the back of the tongue, and it connects to the soft palate. So when you say "ah" for your doctor, or you're singing a really high note, "ah," right? Because once you get a good function of your tongue, you're going to want to sing about it. Then the palatoglossus is what raises the soft palate, and so the tongue will often elevate when we're in the soft palate, but sometimes it needs to depress, such as when we are saying "ah," right? The back of my tongue is going down, and the roof of my mouth is the soft palate is going up, just the soft palate, not the hard palate. And so when each of these things is not working very well, or when some of them aren't working very well, or when the mouth is very small, then if the jaw is very small, this bone area, we've got the upper jaw here, and this is the front tooth, and the lower jaw here, and this is the bottom front tooth. And then this is just a cross section, so you can see the muscles. Normally the jaw would continue, that jawbone fills all the way through so that the muscles can connect all the way through. And if the mouth is really, really small and can't fit all of these muscles, it's going to push those muscles back into the airway, into the throat and breathe way. And so then a person won't be able to breathe as well. And they're going to feel like they suffer from allergies and that their symptoms are just overwhelming because everything in their throat is really small and it gets swollen anytime they come across anything they're allergic to, or when they're sleeping and everything relaxes and there's nothing holding those muscles in contraction. Contraction of these muscles actually elongates and opens up the airway. Sounds kind of interesting because when we lift weights, our biceps and our triceps and everything else can get really big and bulky, right? But these muscles are not skeletal muscles, and they're smooth muscles, and smooth muscles can get long and kind of narrow when they are strong. And so we want to we will work on strengthening those muscles so that the muscles stay where they're supposed to and they don't collapse on each other when we're sleeping. And and then we might need some expansion. Might need some help from an orthodontist or a neuromuscular dentist who can help us expand the structure of our bones so that the muscles can stay in the mouth and keep that airway open and they're not getting in the way. And and so this is why it is super, super important that if you are snoring or you're not sleeping through the night or you're having sleep apnea or you're wake or even though you're sleeping through the night you're waking up exhausted and you want to take naps every day and and maybe you're waking up with a dry mouth or you're often getting cavities even though you brush and floss every day and all of these things can be related to mouth breathing or to poor oral function. And you should definitely have your airway checked by an airway dentist. And then they may or may not send you to us. If there's something else going on, then we will send you to a different kind of specialist. But definitely have your airway checked.